Good morning. My name is Spandana Sama, and I'm a logistics coordinator for the 12th annual UC Davis Pre-Medical and Pre-Health Professions Conference. Before we begin, I would like to thank AAMC for sponsoring this conference and making this event possible. Today, I'm honored to welcome Dr. Reid B. Blackwelder all the way from Kingsport, Tennessee. He's currently the president of the American Academy of Family Physicians. Dr. Blackwelder has been part of this association for 34 years and has worked on countless of committees and commissions, focusing on continuing professional development and education, accumulating to his 2008 Exemplary Teacher of the Year Award. He is also the professor of family medicine and the director of the Medical Student Education Division at James H. Quillen College of Medicine. Dr. Blackwelder has won a plethora of awards, ranging from Outstanding Family Medicine Attending Physician of the Year to Mentor of the Year twice in 2001 and 2010. Earlier this year, the General Assembly of Tennessee has recognized his work and skill, commending his excellent work and his contribution to society. Without further ado, let us all welcome Dr. Blackwelder to the stage.
Thank you. All right, I think I'm mic'd so I can move. It's nice to see all of you. Normally, I would ask you to come close and we would sit down at a table and have interactions, but I'll save you that. So, but I appreciate your being here. And when you hear all that stuff being said about people, the bottom line is it just means that I've never learned to say no. And this is one of your challenges, is how do you do things a little bit different. So I wanted to talk to you about a couple of things, and I'm very open to going in whatever direction, because a small group here, but I also know that there's an audience online. So I'm going to go through a process. When you look at this whole thing of wanting to be a physician, and again, small group, I'm still going to play the game, because I like to get interaction. So how many of you currently sitting in here are at least sort of thinking about maybe medicine as a career? Fantastic. Good answers. You're in the right place. All right. Second thing is, how long have you thought about doing that? Because when you look at it, this is often what a lot of people say. When I grow up, I want to be a doctor. I want to be a physician. So a lot of people will say, from the moment I can remember, whatever age that is, I want to be a physician. And I love that, and that's a great place to be. You might tell I'm a little non-conventional. In fact, it's common when I go and speak in different places over the years, people will come in and look at me and go, "You got to be kidding. This is really a physician?" But I try to wear a nice suit, so at least I can mess with you a little bit, because the beard, the hair, the earring is a little bit odd. But I'll tell you that this particular story, when I grew up, I want to be a doctor, that doesn't really fit. That's not me. That was not what I wanted to be. I never wanted to be a physician. There was no physician in my family. I wasn't going to do that. And then I'm sitting there, and I'm at Haverford College. I'm an Atlanta native, one of the very few people in the world born and raised in Atlanta. So I go away to college. I go to Haverford College outside Philly. And I do some things, and I find myself somehow majoring in molecular biology. And I suddenly went halfway through my junior year, oh my God, what am I going to do with this? And I loved it. I loved the research, but I also said, this is not for me. It's not what I want to do. Good news is that while I majored in this, it was a wonderful liberal arts school, so I did some funky things. I took Icelandic sagas, Athenian civilization, philosophy, creative writing. How many of you have taken creative writing? Oh my God. That was the most humbling thing I ever did. Here I go, I think I'm bright. I'm suddenly with a lot of really bright people. We write something. It is very humbling to have somebody say to you, that sucks. And I wrote a poem, I was so proud of it, about my mother. And they've said, well, this is really not a very good poem. So they're very, very hard. I learned a lot in that time, but I took all these unusual courses, but really enjoyed them. But then, let me ask you, how many of you in this room want to change the world? Okay, how many of you want to change it in a good way? Yeah, because thank you. Some of you hesitated. I want to make sure you're very wise. Wait a minute, changing is not always good. Well, the key is that all of us want to make a difference. This is really part of why you're here this weekend. You want to make a difference. You want to change things for the better, and I applaud you for that, because Lord knows we need some help. So I want to talk about medical school briefly, because some of you are interested in that. So I kind of have to talk about this, and you've got workshops on it. I'll talk a little bit about family medicine, but quite honestly, you're just trying to figure out your way. I didn't know what I wanted to be when I was a junior in college, and I went to medical school. I didn't know anything about family medicine until late in my time at Emory, because Emory didn't have family medicine. I was in Atlanta again. So you can tell courses are not as critical because, I took all these strange things. So the good news is medical school is more open now, even for liberal arts as your major. My own school has taken away some of the requirements. That being said, I think it really is important that everybody recognize science is still a critical component. You got to do well in it because the sciences are a big part of the healing arts. So you do have to do that, but you don't have to focus on that only. So these are some of the other things, and I know other speakers have said this to you. As much as I have issues with a standardized test of any type saying much about you as a person or as a candidate, they're still important. You cannot ignore the importance of this particular test for medical school. You've got to do well. Well, halfway through my junior year, didn't want to be a physician. Oh my gosh, I guess I'll go to medical school. I took the MCATs, middle of lots of other things. I did okay. I didn't do great. I usually do really well on standardized tests. I didn't do great, but I didn't do horrible. But my pre-med advisor, who was already annoyed at me showing up late, said, take it again. I said, okay, I'll dedicate myself. I'll study. Well, that didn't happen quite the same way. So I took him again. I got about the same score. So I just said, okay, I'll just see what happens. Happily, it was a fine score to get into places. But do focus on it. Just don't take it too personally. If you don't take tests well, prepare for it, because this is how you get through the first hurdle for medical school. Some places will not look at you depending on your score. That's why you have to emphasize it has to be there. But then you have to do some other stuff. Social media presence. How many of you are on social media in some way, shape, or form? Okay. So, and how many of you tweet? Good, thank you. You seem hesitant, but you tweet, right? Tweeting's kind of interesting. Actually, your generation's a little different. Twitter is not really a millennial thing for some reason. I'm not quite sure where it fits, but it's actually a slightly different group. I was challenged when I got on the board of directors of my organization by a group of what are called our young physicians, our new physicians, and they basically said to our leaders, you need to get on social media because a lot of them have gray hair like me. So I went ahead and made a commitment to do that. So I took over the AFP Prez with a Z Twitter account, and I took over the Facebook. How many of you do Facebook? Okay, that's more consistent. So I'll tell you, it's not a secret. I hope you know this. When you apply for anything nowadays, graduate school, medical school, any health profession school, a job, a residency, we Google you and we look for you on Facebook. And I bring this up because right now, I remember my college days, have a good time. There are a lot of ways of defining a good time. Unfortunately, people can now record good times every time you're anywhere, and they can show up. You should be looking to see what your presence is. Do not have a personal and a professional. From this moment on, you're sitting in this room, you're coming to this weekend, you are considering a professional career. You are professional as of this moment. That does not mean you can't have a good time, but please be careful what you post in terms of photos, comments, quotes, whatever. Make sure that, and whoever's important to you, whether it's your mother, your parents, your grandparents, whoever, that they would be proud of what you post, or at least find it thoughtful. If not, don't post it, because we are looking. That's really critical to get in. Then you have to have service. And it needs to be real service, not just service to buff your CV. You've got to do something, and you've got to want to do it. You've got to have the passion for this. It really is about service in so many ways. And we're going to ask you, what are you doing and why? Here's the main thing. How many of you feel like you are incredible, phenomenal candidates? You better raise your hands, because if you don't feel that, we're not going to sense it either. So let's try that again. How many of you feel you're incredible, you're brilliant, you're intelligent, you are what it takes to go into medicine? Thank you. That's it. That's proud. That's what you got to do. You have got to carry that forward to me, and I've got to believe you. You can't just say, oh yes, I've won the Nobel Prize, Habitats for Humanity, and I've won a few math awards. Everybody's done that. Everybody's paper looks brilliant. Who are you? Tell me your story of your service. Be sincere. I know when you're not. Don't do something because somebody told you you had to. I want to hear the story of what you were doing because it is you, and it speaks to who you are beyond your numbers. This is so important, and it's how you tell stories. I'm a family physician. That's what I do. I listen to stories, I tell them, I process them. It's what I do in advocacy. You have to do this. You come and tell me a story. You got an X block of time, and I want to hear your story. I don't want to hear your summary of your CV. I want to hear your story. Who are you and what makes you special? Why should I give you one of my 72 spots that I have in my freshman class? Why should you get one of those? Not just that you're brilliant, but I need to hear it. You also need to persevere. It is getting challenging. It's getting full. Do not take things personally. Do not give up. If you do not make it, I'm going to ask you in your interview, what happens if you don't make it? What if I don't give you one of my 72 spots? You need to have an answer to that question, and I hope the answer is going to be, I'm going to keep trying because this is what I want to do. What are you going to do? I'm going to do something different. I'm going to find out what it is you feel I need to add, and I'm going to see what I can do to become an even stronger candidate next time. I need to hear your story about that, not, oh, well, I don't know, I guess I'll take some classes. Tell me stories. It's all about how do you move forward from this. And I know we all say this. How many of you want to help people? Of course we do. And it's funny, I heard somebody say, isn't that kind of cliche? Of course it is. But I don't know how else to say it. We go into medicine because we want to help people. We really do. So don't worry about it sounding cliche, but then I'm going to say, well, how are you going to do it? Because everybody says that. I want to help people. So what are you going to do? Part of this is there is a social mission. And I feel very strongly about this, that our medical schools especially should be doing a better job of graduating the workforce this country needs. They need to do better. We don't do well. That's why we have a problem in healthcare. So we need to find ways of doing this better. And I want you to talk about it. What is it your communities need? Where are you coming from? What's your story? Why do you feel compelled to do whatever you want to do? And there's nothing wrong with being any kind of physician. Of course, right now, how many of you have an idea what kind of physician, what kind of specialty you want to choose? Okay, good. I'm proud of you. You have an idea. First off, part of me wants to say, how in the world can you have an idea? Because you're not even in medical school yet. And I know you've hung out with people, you've got role models, you've read about it, you've watched television, whatever it is. You don't know until you're there, and I'm afraid medical school is artificial. We show you a side of medicine that is unfortunately academic health centers, which is not where medicine happens. You don't see it for real. We protect you. You don't even see it in residency as much. Bottom line, you've got to have some vision. I need to hear it. But be open because you're not informed yet. You don't know. And hopefully something will call you. I had no idea I wanted to be a physician until late in life, and I had no idea what family medicine was because Emory didn't believe in it. I found out about it because I didn't want to make a choice. I could not choose. I like delivering babies. I like kids. I like healthy old people. I like having people with heart attacks that I could help. I like surgery. I liked it all. So I actually asked at Emory, which had no family medicine, I said, do I have to choose? They kept saying yes. And I said, no, I don't want to. And they sent me across the street, Grady Hospital, downtown Atlanta, into a little building of community health. Now this is my memory. I'm sure it's not entirely true. I walked down the steps into a dark hall. I found a man in a room. He was actually head of the physician's assistant program at Emory. That's who they sent me to talk about family medicine. He sat me down and he took a book off the top of his file cabinet, dusted it off, and opened it, sort of like a Harry Potter movie. Now, I'm sure that part's not entirely true. But that's what I remember because nobody asked about family medicine at Emory. I was one of 2 in my class who went into family medicine. And I went into it because I didn't want to say no to a patient. I'm sorry, you're the wrong sex. I'm sorry, your organ system's the wrong one. I'm sorry, you're too old. I'm sorry, you're not old enough. I'm sorry, you're the wrong gender. I didn't want to do that. I wanted to do what family medicine does, cradle to grave. It's incredible, but everything else is too. So following the call to service, how do you help people? Social mission, and a lot of this is service to others. This really is about others. I mean, you put other people before you. It is a hard thing to do. It doesn't make sense. You want to go out to dinner. You want to go on a date. You want to have some time. You want to have a life, as I've been asked. And all of a sudden, your phone rings. Back in my day, the pager went off, and you had to answer. That was what you said you were going to do. You're a service to others. Really challenging. Good news. Your generation especially, and there are different ages in this room, I understand. But a lot of folks currently in college are millennials. They're into service. You're into this better than most other generations. You're also into teamwork. You know about working in teams. You're used to it. This is something you specialize in. You have what we need in this regard, something we've got to do different. But here's the key. This is a stupid job. It's a dumb job. Hi. How much debt are you going to have? How many hours do you work? How much do you get paid per hour? What in the world were you thinking? It's a call. It's a call to service. Horrible job. Silly job. It's an incredible calling. That's why you do this. And I respect that, but I want to hear your story. Let me hear how you were called and why you were called and where you came from. So briefly, some of this is really important. I've been involved now in organized medicine and taking care of patients and teaching and having a life and doing all this because I want to make a difference. I want to change the way the world works, and our world needs help. How many of you have heard of the triple aim? I put quadruple. How many of you have heard of the triple aim? Okay, I see a nod. You've got to hear about this stuff. You've got to learn, and I'll talk about informing yourself soon. This is why we have issues in healthcare right now. The triple aim is all about fixing the problems. One problem, improving outcomes. We pay more in this country per person for healthcare and have bad numbers. We pay more than twice, almost 3 times as much as anybody else, $8,000 per person per year. And our numbers, I don't care which numbers you go to, we're number 37. And that's compared with all the countries that are equivalent for us. We have horrible patient outcomes overall because we don't have a primary care base here. We also need to have patients satisfied. I know you each know stories. How many of you can tell me a story of either your personal or your family involvement with medicine that is not particularly happy? Okay, we have a lot of those. Now, hopefully we also have good stories, but we all have those, oh my God, this is nuts. I will tell you right now, my patient who I'm going to be seeing her, she's got a horrible problem, young woman with bad rheumatoid arthritis, knee replacements, has already had heart attacks, she's 44, she just had a pacemaker. She came to my office the other day. I wasn't there, I was teaching. She's changing to follow me regularly. She needed labs from her cardiologist, the discharge. I asked my team, would you please find out what needs to happen? It's Friday with a holiday weekend coming up and I'm traveling. I got to have this information to direct her care. Did not happen. They couldn't figure it out. So nobody called me back, even though I knew it was happening. Nobody called to say, Reid, I'm having trouble, because I would have found it. So in traveling, at each of the places while I was coming here from the East Coast, I would stop. I arranged to make sure she got the labs done. I called the lab personally to get the results. I'm managing that care. We are so not patient-centered, it's not even funny. And it wasn't mean. It was just failing to answer the call to serve. Patients are not satisfied. And we got to lower costs. I put in quadruple aim because we must also be satisfied. How many of you have worked with a physician or a medical student or a resident who is burned out and not particularly happy with what they're doing? If you haven't seen it, you will. You will. My partners, I've got people who are, my staff, the reason we're not patient-centered, somebody's burned out. It was too much extra work. We have got to change things. I've got to take care of patients. That's what I want to do. I don't want to do paperwork. I don't want to submit billing check boxes to the insurance company. That's not what I was trained to do. These are the things we have to work on because that's our satisfaction. So here's what we need now. In this country, we need to make sure everybody has insurance coverage of some type. The moment that anybody's left out, there's cherry picking, there are things that happen. This is part of our problem. So we absolutely have to provide it. This is one of the 2 things that improve patient outcomes, and we know this from lots of data. The 2 things are having insurance coverage and having access to comprehensive coordinated care. You've got to have both. ERs don't count. You've got to have both. So we've got to have coverage. Primary care needs a voice, and we do have one. People are talking about this. I could give you lots of lectures on what this is, what it's not, who calls themselves this, but it really is basically family medicine, general internal medicine, general pediatrics are the true primary care specialties that everyone agrees on. We need to have that as a foundation in this country. The rest of the world has figured that out. They're about 65 to 70% primary care base, 30% subspecialty. Our country's 30% primary care base, 70% subspecialty. That doesn't mean good or bad, but when you look at our outcomes, one of the main reasons for that is we don't have the primary care base. We have a lot of subspecialty procedure care and ERs. We got to fix it. We also need to have a patient-centered medical home. How many of you have heard that acronym, PCMH? Patient-centered medical home. Okay, good. So at least one person. This is a huge thing. Politicians are talking about it. My organization 10 years ago was instrumental in moving the patient-centered medical home forward as a point of discussion. But once again, what does it mean? How do you define it? How do you work on it? This is how we're going to be doing things. This is going to tap into your skill set. It's about service. It's about community. It's about working together in a team. We need team-based care. No one person can do it. I love full-scope family medicine. I was the last family physician still doing OB until I got involved in what I'm doing. I wasn't home enough. So I've given up OB now. And that's okay, because one of my partners does it better than I do. I can't do everything, but I do some things really, really well. So how do we work as a team to make sure people get right care, right place, right person, right time? And the most important thing is it's about community care. That's why I love this event. I mentioned this last night with some of the other keynotes. This is walking your talk at this weekend of recognizing everybody has to work together, because that's how communities get better. You need dentistry, you need nurses, you need primary care, you need subspecialty, you need veterinary medicine, you need PT, OT, allied health. You need all of this. You need an educational system. You've got to work together to make this work. Really, really critical. So what about the future? How many of you feel good about the future? Okay, it's a little distressing. Not all of you raised your hands, and some were very slow. Okay, thank you. Appreciate it. Noted. Yes, happy about the future. You know, well, here's what I would say. The future is so bright, you got to wear shades. The bad song, one of my partners actually used that as his campaign speech, and he got elected. But this is when I was installed as the president, they surprised me by all wearing a beard. You do not have to have a beard to have a bright future, but it doesn't hurt. I really think things are encouraging. I think we're moving forward. By the way, yes, this is truly when I was installed as president. So I have some interesting outfits, but I was elected. So I just want you to know I'm actually legitimate. I do represent 115,900 family physicians. So it's possible to move forward even looking as I do. Primary care is going to be foundational. We're talking about it. We've got to define it. It is going to be the way we go. It's the only way that makes sense. And the opportunities are and will be plentiful. And you're going to do fine. Don't worry about it now, but I know there's a lot of anxiety as we move forward. When you look at this, you've got to have relationships. You've got to have stories. This is what medicine needs to be right now. You've got to create connections with people, not with electronic health records. You've got to get the stories. You have got to remember your responsibility to society. This is really key. This is what drives us. It's the call to service. This is what inspires us. It's what motivates us. It's what makes this the best and most incredible job in the world. The best and most incredible career and calling. Because I think it is an awesome job. I'm really blessed to get to do what I do and to have people invite me to do it more. It's a phenomenal opportunity. So start now. You got to inform yourself. And this is not about school. This is not about the textbooks. This is not about all the stuff that you have on your huge to-do list. The world is happening around you. You must get informed if you're going to impact and change things. And you have to be informed, and you have to commit to your decision. Don't spout off somebody else's. One of the most challenging things of working with me as a teacher, when you're in my classes, you'll give me the right answer. And you know what my next question is? Why? Very annoying, yes. And they already know it. They're afraid to even ask. It doesn't matter. You can not make eye contact. I'm going to come ask you stuff. I'm going to stand in front of you. Normally in my lectures, I'm right there and I'm saying, why? Not because you're wrong, but what are you thinking? How did you get there? You've got to be informed. You've got to think. You've got to challenge yourself about this. What do y'all use as far as, I put news in quotes because most news is not news. A car fell over. Traffic was stopped. What? That's not news, but yet that's what you see. What do you use for news? Some quick, what do y'all do to inform yourself? What do you do? New York Times. Social media, like what?
Well, personally, I follow a lot of blogs of people who are really eloquent and who are very involved in world affairs. People from all across the world, so I get a lot of information.
Excellent. Great.
From people that I trust and respect.
Is that on Facebook or their own blog or what?
Their own blog.
Okay. And these are some of the options out there. And I would say most of it is not news. If you watch Fox, you need to watch MSNBC at the same time to get both sides. Most people don't. And that's really hard to do, by the way. If you like one, you hate the other. But they're both extreme. You got to find something in the middle. And you really do need to use social media in different ways. So I have one suggestion I'll make as we finish up here. This is the key. You must vote. You must vote. Period. I don't care who you vote for. Well, I kind of do, but that's not the point of the discussion. You've got to vote. Thomas Jefferson has said, our country is not led by the majority. It is led by the majority of those who vote. When you have 20 to 30% of our country voting, that means a very small group of people dictate what happens to your world. You must get informed. You must vote. You must. Information, if you are on Facebook, feel free to follow me at AAFP President. I want you to notice this was my posting the other day, so can you notice, sir? You were on my Facebook blog. This is me telling my story of what I've done this year. I'll be going back to my own personal site once I'm no longer president in 10 days. I'll be the chair of the board, but you can follow me at Reid Blackwelder. Just Google me. You will find way too many pictures of me on the internet. But this is a way of me telling stories of what's happening. And I'm going to, in fact, somebody please take some pictures and send them to me so I can send them on my blog, on my Facebook page. So anybody who's taking cell phones, Blackwelder at ETSU, or Blackwell, Blackwel at etsu.edu. I would love some photos, and I'll put this out telling my story of being here at UC Davis. So this is the finish. Okay, it really is about some people are born to change the world. I would really change that. Everyone has the capacity. But there's absolutely no question in my mind that all of you attending this conference, this is you. This is why you're doing it. You are here to get informed. You're here to find out about a life path that means something. And I applaud you. I encourage you to seek me out. I ask you to find other people. Use this time to create connections. Because even now, it's about relationships, it's about stories, it's about hearing why we all answered the call to serve, to inspire you. Because the day-to-day grind of being a student, the day-to-day grind of being in medical school or residency can feel overwhelming and get very frustrated. Somehow you've got to stay inspired and realize this is the most amazing opportunity. So thank you very much for the time to be here and for the chance to speak with you. I look forward to future connections. I have no idea what the timing is of things now. Happy to answer some questions. I'm going to be around, but so I have, what should I do? Should I just be done? Outside. All right. I'll be right outside if people want to have. Thank you so much.